So welcome back to our channel, and it's 2026, so this is our first one. We have a very exciting new subject to talk about today, so let's get on with it. So 2026, we're here. Okay, things feel slightly different this year. We were just discussing about what people were expecting and looking for in the new year when it comes to rejuvenation. What do you think? What have you picked up in what people are asking for when they come into our clinic?
And they're looking for non-surgical procedures, basically. So more natural beauty, enhancing your natural beauty. I feel, I'm not saying for all, but I feel like people are now trying to come away a bit more from the fillers and the Botox and trying to use what they already have. That's what I'm feeling.
Yeah, and also I'm finding that people are moving away from even aggressive surgery. Even we had a lady last week where she didn't want to go down the route for a big facelift procedure. She accepts that when you have a bigger facelift procedure, the results are significantly longer lasting. But the downtime has been off-putting, so patients would prefer to have a smaller procedure under local anaesthetic, accepting that the results won't be as longer lasting and won't be as dramatic as having kind of an involved facelift procedure. And I think that's what we're heading towards this year. That seems to be the trend.
Yeah, certainly a lot of the conversations I have with people go down that route.
People are being really secretive as well about their surgeries at the moment. That's what I'm finding.
Yeah.
Because I'm having a lot of conversations and it's very much like, I want to be discreet. I want to be meeting my friends the weekend, for them to notice but not notice.
Yeah, you're right.
Yeah.
So people want to have the surgery and feel and recover quickly enough for them to carry on. And I think
No downtime.
No downtime. I don't think people have been aware of it. It hasn't been because
their knowledge would have been just of the general anaesthetic procedures more so.
Yeah, absolutely. And I think it might be a reflection of people are now going out more because we've come out of COVID. People were a little bit more internal,
Highly sociable now.
We are now. It's a sign of us being more sociable and wanting to go out as soon as possible. So that's a positive sign in terms of social thing, but also it reflects how we need to provide the service to what is needed out there.
Yeah, and it is amazing what you can do under local.
Yeah.
And how quick the results are within, some people are really good and bounce back really quickly.
Yeah, but you can still do quite a lot under local.
Oh, 100%.
Because you've seen some of the local anaesthetic leather necklace, and what did you think?
They're incredible.
What did you think was the worst part of it?
Well, they don't ever see it, do they? When I see you doing I feel like, wow, okay, that's quite a lot.
Yeah.
But they're talking that, and they're talking, and they're totally fine because we keep them relaxed, and everything's under really controlled, which is lovely for them. But yeah, you can do a lot. You can really do a lot. I really like the blephs that you do because they don't take that long to do in the grand scheme of things. What, within a week, 5 days, you then
take it on.
Yeah, that is instant impact.
And I think maybe because the generations that we now have, people are generally looking after their skin a lot more than the way, a lot older generations. So these little procedures actually have a massive impact because their skins are generally good anyway. So I feel, the 60, 50-year-old market is that, they're really, they're doing well with their skin.
Yeah, but the only thing about doing local anaesthetic is that sometimes they get concerned because it's local and they're in and they're out and they bounce in and they bounce out. They can sometimes underestimate the recovery period.
Yeah.
And how you need to recover. So sleeping upright after the neck and facelifts, keeping everything dry when they're like going crazy with everything itching.
Laying off skincare.
Laying off the
whilst they've got everything.
Yeah. And keeping it nice and dry. And I think that can be quite off-putting.
Yeah.
Or they underestimate it. And it really does affect. Would that put you off?
The recovery periods, no, it wouldn't, and I would follow it.
Yeah.
But I'd be in trouble from you if I didn't.
We can tell who has and hasn't followed it.
Yeah, absolutely.
For sure. Just thinking about one when they took everything off themselves.
Yeah.
It's like, oh, Okay.
I think as people are more aware of what's available as smaller procedures on the local, they are going to opt for that because you don't have the fear of going under a general.
And the cost implications.
Yeah.
Like it's a real big difference, isn't it? And some are happy that it will not last as long.
Yeah.
Well, it might have only cost half anyway, so having that again 10, 15 years later still doesn't make it any more expensive. So.
Yeah. And what do you, and then now we've kind of also, I think that massively influences things, is our approach to Mounjaro and Wegovy. So we had a massive price hike with Mounjaro, which made a lot of people go to Wegovy.
Yes.
Which I don't know how effective it is.
I don't think it's as effective.
You don't think?
No, I don't. No. And I sometimes think if you're on something and it works, in the long run, are you really saving? I haven't done Wegovy, but are you really saving in the long run? Because you may have to be on that longer.
Do you think it's still as popular at the moment?
100%.
Do you think? There's a lot of
injections.
There's a lot of complications coming out.
Yeah, but I
And studies to show.
But there's a lot of complications and studies for everything.
Yeah.
You know. So I think there's always, as you've always said, with surgery, there's a trade-in, isn't there?
Trade-off,
The trade-off for everything. You know what you're doing. If you're doing it correctly, I personally don't see an issue with it.
We, in terms of weight loss, one of the things that people are affected by the weight loss is having the saggy breasts.
Yeah.
Or what we call the ptotic breast.
Yeah.
And that can happen after childbirth, it happens with age.
Or any weight loss, surely, not
Any
just
weight
from
loss,
injections,
any weight loss. And one of the things that people find quite surprising is that when they hit the menopausal period, their breasts can sometimes hypertrophy, so it gets even bigger. So breast reduction is another procedure that we've been seeing quite a bit of.
Yeah, lots.
Quite a bit. And what are your thoughts on breast reduction surgery?
I think it really makes a difference for people.
Oh,
Such a big difference. This is causing pain and soreness. This changes their life. And actually, the breast reductions are not so much for the outward show. Like breast augmentation, it's sort of, you perhaps want to show that a little bit more cleavage, but actually with breast reduction, that's not what people are thinking.
No.
They want to eliminate the back pain, the straps digging into the shoulders, the soreness underneath, and they're just pleased to get into clothes that create more of a silhouette.
Yeah.
I think it's
such
one
a
of the best
confidence
surgeries. It's got to be honest, the weight of carrying around heavy breasts is
quite significant.
Isn't it?
Yeah, and one of the things that I'm still quite surprised about when people come in with their large breasts is the attention they still get from men with their large breasts.
So we get that a lot actually with clients saying that they're really looking forward to not being ogled at.
Yeah.
I see.
Yeah, so having large breasts, it doesn't matter how old you are, how young you are, having that large breast and still gets a lot of unwanted attention from people of all ages when they're just simply walking down the streets, and how that still happens, which is quite surprising, I would have thought, in this day and age. But
it must be one of the highest satisfaction rates for that surgery.
Yeah, it's very satisfying.
I won't name the client, but I have one that I really like, and she is like a little sunshine of energy now. She's completely changed. She's just, I think she looks great.
And what do you think the downside of having a breast reduction?
I don't think there is any downside, because they are heavy, and their whole posture is completely different to when they then have a reduction. They're straighter, they're kind of, I don't know, a few of them I find, they're looking down, they don't really want, because I suppose when your posture is higher, but they just seem a lot more confident. They come in, they don't feel very confident at all, and they leave, and they just
hiding under baggy clothes.
100%.
One downside, I think, is the rest of the silhouette. That they might not be prepared for how their sort of abdomen region might look. So it's you reduce the breast, they might then feel their tummy is protruding a little bit more. Would that be fair to say? So. That might feel a bit disappointing for them, do you think?
I don't think, because the physical improvements with the breast are so high, I try and point that out before the surgery. So particularly people who haven't reached their healthy BMI. If you lose the weight and reach your healthy BMI, I make the breast in proportion to the rest of them. But if you don't reach your healthy BMI and you still have that weight or that barrel weight underneath the breast, and then we reduce the breast, it changed the body silhouette from something that was quite feminine because they've got the big breasts compared to the tummy, to something a little bit more square because I've reduced the breast down on the side profile and the stomach is still out here. That's why it's really important to lose weight to a healthy level.
To be where you want to be first. So I mean, it's not really a downside. It's more of a having an awareness and
a trade-off, I suppose.
Or do the work beforehand and get to the desired weight.
So losing the weight is really important for the outcome of the surgery in terms of complications, but also cosmetically you will get a better aesthetic result if you reduce the weight, reduce your tummy, and then I can take more back. So it still maintains that feminine figure after having a breast reduction. So I think that's a really good point. You can functionally improve someone at the top end, but if you're not improving the rest of you, because you are a whole person, cosmetically, you may not get the
focus could
optimum
become
result.
onto something else. Yes, but I don't think anyone's ever said that they have a regret or that there's a downside.
No,
I've
because
not
the
heard
functional results are so beneficial.
Oh, they must feel as light as a feather when they go. That must be amazing.
Yeah.
And I think their clothing, because the bras that generally the women have got are really thick strap bras, aren't they? So you've got to hold everything up. But now it's, we've got some that are in tiny little tops and vest tops that they would never be able to wear before. So it's nice.
Yeah, and I think so we are going towards, we're seeing a few breast reductions, which for functional reasons. And the other thing that we are seeing a lot of is removal of implants. So people are heading towards quite smaller breasts. And even if the girls that want to have, or the ladies that want to have breast augmentation, they tend to be a little bit more conservative in how big they want to be.
Yeah.
It's not the look now to be huge breasted, is it? When was that, the 90s? I don't know.
Yeah,
so
the
90s.
90s and noughties people wanted. I remember only 5 years ago, I was putting 450cc implants, which is quite big. And now, probably the maximum I've put in this year, I think, is about 340cc. I mean, obviously it depends on how much you have in the first place.
Yeah.
But those days of having 400 plus cc implants, it might be just the group of patients that I have. But I'm certainly seeing a trend.
I'm not entirely sure if all those years ago the information would have been given to patients on the fact that implants were not a forever thing. I know you certainly do now, but I don't think back then, I don't remember hearing anyone ever saying, but if I have this done, it will need to be changed down the line. So as well as it not being quite the look anymore.
And people were putting them in at lunchtimes, and certainly in the US it was quite a big thing.
But the health fears now on that in the body is not.
I think it depends as well, like what changes at the moment. It's very thin aesthetics, isn't it? And very health conscious. Everybody's gone down a real healthy route, which is great. Whereas probably 2-3 years ago, we were embracing the bigger women, which is still great, but it's not as desirable as what it was before. We were all about bigger bodies, and I don't think that's a thing so much at the moment.
But ladies used to feel really self-conscious if they were small busted, as if it was a fault.
Yeah.
And then implants solved all of that. But I don't think the youngsters feel at all self-conscious if they're small busted now.
No, I don't.
As long as they're symmetrical. I think that's their main issue. Even when they're small breasted, they don't really, the focus isn't necessarily on volume. It's more on they just want to look the same on both sides.
But give it a couple of years, it might flip a switch and go back again. Skinny jeans were here, now no one's wearing skinny jeans.
No.
It just depends on the fashion, doesn't it? Where people are, what celebrities doing. At the moment, the celebrities are all seeming like they're doing Ozempic and, the skinnier, the better in their eyes. But it is a very different reality to what it was, for sure, a few years ago. It's completely changed. I mean, Lizzo, who was the body confident woman, she's now doing Ozempic.
Oh, she?
Yeah, she's completely different now. She lost loads of weight. Adele, I'm not saying Adele wasn't Ozempic, but she looks completely different.
So people are heading back towards. I don't think that we're going as skinny as we were. I remember in the 90s
with the supermodel
with
region.
the supermodel, they had a very super skinny.
Yeah.
I don't think.
But they were doing like drinking and drugs and smoking, whereas I don't feel like people aren't seeming like they're doing that. It's very much like matches and
They want
Pilates.
the sporty. It's interesting. I had a program on in the background. It's called The Beauty. Have you seen it?
No.
It's so interesting.
What's that one?
So basically, it's on Disney Plus.
Okay.
And it's about a group of people in society who have now discovered an injection.
Oh, I've seen that advertised because one
It's
of
Ryan Murphy.
and isn't that one of the Beckham's son's wife is in it? She's in it. Yeah. No, his now wife.
Isn't that
Anyway, she's in it. Yeah.
So it's basically you have an injection.
Yeah.
You go through this horrible morphine stage, and then you come out really hot. And young. So you've gone from, so they had the Ozempic era, so they just come out of the Ozempic era where people are very skinny. Now they want to look hot, and they look super, super, super hot. And what's interesting about this is that the super hot people on that, none of them are actually super skinny. They're all healthy.
Yeah.
In fact, one of the women in there that took the injection, I forget her name, she was one of the detectives who accidentally got infected by this injection virus. And she was slim before the injection, and afterwards she had a slightly more fuller, healthier figure. So she didn't go skinnier.
Okay.
She was the perceived beauty in this show at the time is someone that has a slightly almost athletic build. Which is good.
Yeah.
It's good. So they're not perceiving someone as super skinny as attractive. It's healthy. They all have.
I do wonder what the next thing will be.
It might be that.
It may well be that.
That's it.
Yeah.
Because they're now trying to bring out something that's in a pill form, isn't it, rather than you injecting it. That's
For
what I
what?
heard for Ozempic.
Yeah.
The thing is,
Mounjaro.
as you're more my age, it was always a thing that being really thin it made you very fragile. So it wasn't recommended to be that way.
Yeah.
So surely it will move away from that because
I hope so.
for your bone mass and it was just everything to have muscle.
Yeah. In my ideal world, I think rather than look at figure, we look at blood pressure, heart rate, sugar level.
But is BMI as relevant? Is it as accurate and relevant as
I mean, it's not accurate for extreme body weights and extreme lifestyles. So for someone who's high muscle density, they're going to have a significantly higher BMI because muscle is very dense. But they will have a high BMI on the scale, making them overweight when they're not overweight. They're just very, very muscly. But for the average person, I think it's very relevant.
It's still the best guide.
I think so. When my BMI was really high,
Yeah.
I felt heavy.
But we don't look at it in isolation.
No.
We look at it in conjunction with the rest of your lifestyle, your blood pressure, your heart rate, your diabetes.
Yeah.
No one should be looking at BMI in isolation. It needs to be looked at in conjunction with your lifestyle.
Yeah.
So it is relevant, but as one of the factors in many factors that we use. So you could have a really high BMI, but if I know that you exercise regularly and you're genetically quite muscly and your blood pressure is fine, then you're fine.
Okay.
But if you have a high BMI and you've got a really high fat ratio and you've got diabetes and you're a smoker and all of this, then it counts as something that you need to take into consideration. So it really does depend on the overall thing. But it was interesting that the new this series did show more attractive people as being the healthier.
Let's hope then.
Yeah.
Let's hope that's the
Not
next
super
thing.
skinny.
Who's going to take it?
He's going to try it.
Well, they all explode.
Is that what happens?
Or in the end.
Well, people who take the virus, something happens to them genetically and they overheat and they explode.
Maybe not then.
So they're working on it.
Okay. Or work in progress. But you think though, like the fact that Mounjaro and all of these other ones are here, it is such a massive thing for people now that they can actually be a smaller version of themselves. But I do feel that there is hate that comes with it.
What,
Of
Mounjaro?
other people, when people get skinnier, I've known a few people that they're just like, all right, okay.
What do you mean?
Well, I think they get annoyed because you were the fat person and then you become the skinnier one, and generally you end up getting skinnier than them.
I think also people, when they see someone that's lost weight these days, where they might have said, "Oh, you've lost lots
Yeah,
of
you
weight,"
will.
no one even comments
No.
anymore because they'll just assume that
Yeah.
you've done it with
100%.
the injections, so they don't even say, "Oh, you look great, you've lost weight."
Uh-huh.
They'll probably be thinking in their head, "Oh, another one who's done injections."
Oh, really?
Yeah. People don't comment.
But it is crazy how you see people and you're like, oh my gosh, you have lost loads of weight.
Yeah. So you're less likely to comment now because it
People
brings
don't
up...
seem to comment.
Yeah, no.
Ah.
So they just
Oh,
assume
okay.
it's like, "Oh, it's not. You haven't done well. You've just been on injections. You didn't have to starve yourself."
Ah.
They're just making assumptions
Yeah.
about it. Yeah, I think so. If you've lost weight,
Ah, so you don't have that. Congratulations,
No.
well done. You've
No.
done
so it
really
just
well.
doesn't get mentioned.
Ah.
No, and I think some people, not but some people just assume it's the easy way out. But I don't.
Like you've cheated almost.
Yeah.
Mm.
And I don't see that because there is a lot of hard work and you have to maintain it. And ideally, it's not a drug that you should or want to be on forever.
Mm.
So you have to come off it
Yeah. Although people are baby maintenance.
on a baby maintenance.
Yeah, it is. It is. It is what it is. Yeah.
But I do think it's great.
But it's certainly shaped the perception of beauty.
But I would say as well, from an NHS point of view, though, surely that must help massively
Absolutely.
with the NHS.
Yeah,
you
To
know.
not be dealing with obesity.
Yeah.
Has it saved resources
Absolutely.
a lot?
I think what it's done, it's allowed people to be eligible for certain procedures.
Oh,
Yeah,
and to
that's what
surgery. Yeah.
particularly for, aspects and things, even breast reductions and other forms of surgery. It means that they've had that surgical procedure. And people who have a lower BMI, we found that all the other comorbidities associated with, all the other illnesses associated with high BMI, like diabetes, high blood pressure, all
All of
those
that's coming down.
have come down.
Wow.
So overall, has improved.
Yeah.
But whether they stay like that
Yeah.
is something that
And
we
it does,
also-
I think it does change people's mindset because once they feel like they can actually do, like to have the energy and have the weight taken off you, being able to put on smaller size clothes, it is a real boost and you kind of want to keep that. You don't want to go back to the old person that you were. So I do think it's really good to reset people's minds because I think when you are bigger, you end up getting stuck in a rut and you feel like you're never going to come out of it and that is your life and you're going to accept it. Whereas I feel that this does give people a second chance, really, to kind of,
Absolutely.
for sure.
Yeah, but like you say, some people might consider it as a cheat. Where
People
but if
just
it
don't
works-
comment on people's weight anymore.
Yeah.
I think they just assume that it's all being done the same way.
Yeah.
So, yeah.
Yeah.
But that, as you spoke about, that healthy image, the more muscular body, that's got to be the way forward.
Mm.
Oh,
Let's
100%.
hope. Let's hope so.
But I do think, like with the doing the Mounjaro and stuff, people are going to the gym now, whereas before they wouldn't have gone. So I think
they
it
get
really
to a
helps.
level that they're confident enough to walk through the door.
Yeah, for sure. And also, you had, can you imagine when I was heavier and running? I couldn't run for very long. I felt really, and I was going to the gym, but I just couldn't work out. Considering, the size of me now, I can run for quite a long period of time. So sometimes you need a help.
Yeah. I don't think
You're not hurting anyone.
happy. Yeah, not hurting anyone. If it makes you happy and it's working for you.
Yeah.
And you've tried all other options.
And I don't know how much it is now. I know it's gone up. I think it might have come back down
Is
again.
it?
I'm not sure. But I still think you'd pay it because you'd end up paying that on going out for meals and all the other rubbish that you would generally eat. You're not doing that anymore.
Yeah.
You don't.
Switched priorities. So are you finding a lot of surgery with the loose skin from
Yeah.
all these weight losses
I
as
think
well?
you are more like,
Yeah.
we've had a lot of, certainly from the hospital,
Mm.
they're coming in with excess skin and wanting to tighten things up, get a bit of a snatched body.
Yeah. I mean, that is the only side, isn't it? I
Yeah.
suppose for some people.
Yeah, having all that weight loss and having the excess skin, that in itself is a big problem.
Yeah, I suppose if you've gone from being quite a big size.
Yeah.
But that's still the same with any form of weight
Yeah,
loss. When
exactly.
you've been several stone overweight for decades, then the skin's going to be there. That's not a reflection just on weight loss jabs, is
Yeah.
it really?
Yeah.
Absolutely. Great. I think that's
That's
a
a nice
good
range.
range to warm us up for 2026.
Oh, yeah.
for our next one, I think we've got some new exciting news, but we will leave it for the next one. So thank you for joining us again, and then hopefully we will see you in a couple of weeks' time again.
Yeah.
Bye.
Bye.